My role was to be the lead speech and language therapist in the DARS study. What people think when they hear speech and language therapy is that it's about working with people who have difficulty with speaking, with voice problems. What a lot of people don't know is that we have a very important role in supporting people with swallowing problems. And this was particularly relevant for the DARS study because what we know is that head and neck cancer is on the increase. It's affecting young people and old people. And what we've learned over the years is that radiation is delivered in over 70% of patients as part of their head and neck cancer treatment. But we've learned that swallowing is a particular problem, not only during the treatment and recovery phase, but also in the longer term as well. And in fact, people may even present with swallowing problems, difficulties with eating and drinking before the treatment even starts. So my role was to work with Professor Nutting and to decide on the most appropriate measures for the study. And I did this work in partnership with another clinical trial that's going on, and speech therapists working on that trial, because it's really important that we have multidimensional measures which are appropriate for the job. I think with radiotherapy studies in the past, they were focused very much on what they call toxicity measures, so effects that were judged by doctors. But I think one of the great advances in radiation oncology research has been the fact now that our radiation oncology colleagues are looking to their speech and language therapy colleagues to support them in selecting the right measures to assess patients. And of course, importantly, that's done in partnership with patients as well. And that was very much embedded in the DARS study. It was very much a multidisciplinary team affair, as it is with the care of these patients. It's really important they have a range of allied health professionals and other professionals supporting them. What we did was there are three types of measures that we used. The first ones are the ones that are most commonly used, which are the clinician-rated measures, which is where the doctor or the speech therapist make a decision about when they question the patient as to what their score is. Then in a subgroup of patients, we did a study using X-rays to assess swallowing called videofluoroscopy, and that was in a subgroup of patients. But probably the most important thing that we need to reflect on is what the patients think of their treatment. And to that end, we used two patient-reported outcome measures, two questionnaires to try and capture about how the patient perceived their swallowing to be before and in the set time points after their treatment. And those measures were carried out by speech and language therapy colleagues across the country in the number of centres who were involved. And what was really great is that the speech and language therapy community really came together with our radiation oncology colleagues and nursing colleagues, physicists, etc., to very much be a part of this data collection and agree those measures, and really contributed to how the study was designed to make sure that we not only got all the measures right, but that they were going to be the right measures for us to be using throughout the study. And we're very grateful to them. Speech and language therapists have got incredibly busy caseloads looking after our head and neck cancer patients, and the fact that they were able to do this as well to support the study and increase our understanding is a remarkable achievement.